Welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's show, we're going to talk about the epidemic of sport concussion. There's been a lot of changes that have occurred over the many years that I've been involved in the rehabilitation of athletes with concussions. Our guest today is Dr. Sandro Corti. Dr. Corti is a board-certified neurologist and fellowship trained in sport concussion. He has a practice in West Long Branch, neurology specialist of Monmouth County. Dr. Corti, welcome to the show.
Thank you. How are you?
So tell us about how you got involved in the area of sports concussion.
So while I was doing my neurology residency, I discovered that there's this new upcoming subspecialty called Sports Neurology. And it's something that's developed within the past 10 years, and it focuses on concussions, post-concussion syndrome, and overall brain athlete health.
Okay.
And so I did a fellowship training in that for a year, and now I'm here in West Long Branch practicing and seeing those patients.
Excellent. It's such an epidemic now in terms of the concussion in sports, and we hear it so much on the news. In terms of the youth sports, it's often an underserved segment of the community, right? So
Yes.
they don't get the athletic trainers on site, and they don't get the education from the schools. So I've been focusing on trying to educate parents about what some of the things they should look for to help them make decisions. So basically, let's tell the audience, what is a concussion, first of all?
So a concussion is an injury to the brain that occurs from either direct impact or whiplash of the head. And it causes a series of metabolic changes in the brain that present as certain signs and symptoms that many people are frequently aware of, and we'll kind of go over. And then that entire process occurs on a microscopic level. So it's not frequently able to be picked up on a CAT scan or an MRI, things you would normally get in an ER.
So there's no outward sign usually that there's an injury like a broken bone or something like that. Obviously if there's a significant injury, there might be some major trauma that's involved. But we're talking about more of the shaking of the brain inside the skull, is that correct?
Correct, yes.
Okay. So now what are some of the common signs and symptoms after somebody has this type of head injury, right? So technically it's a head injury.
Yes.
What are some of the signs and symptoms that might occur?
So the most common signs you'll see are migraine-like symptoms, such as headache, blurry vision, sensitivity to light and sound, nausea, vomiting, and then you can also have other features like sleep changes over several days, mood changes such as irritability, and even cognitive changes like trouble with attention, concentration, and memory.
Now, will all these things show up immediately, or is it something that develops over time?
So it does develop over time. You can see these things as quickly as a few seconds afterwards, but there's often a delay, and usually they'll present themselves within the first 1 to 2 days.
Okay. Is it necessary to have some type of sign or symptom to be diagnosed with a concussion, or is it just you see somebody have trauma to the head or shake their head, would that mean they would have a concussion?
Not necessarily. So there's no one specific symptom or combination of symptoms that means you have a concussion. It's more of a collection and an overall picture, and that's part of the reason why it's important to see a specialist, because someone who's trained to diagnose this can more obviously see when someone is concussed and advise proper treatment.
Okay. Now, in terms of what we think of as the red flag signs, they're really important for parents to understand that. If they see their child or teenager or young athlete, even collegiate level, go through some type of trauma, what are the bad things that you want to look for?
So the bad things are things that suggest a structural injury to the brain. Those would be any kind of weakness. So if you can't move your arm or leg, numbness, a seizure, persistent vomiting. So not just vomiting once, but you're vomiting over and over again. Any kind of vision loss and prolonged loss of consciousness. And that definition kind of vary. Typically, anything more than 30 seconds I consider prolonged and should be looked at the ER.
Okay. Yeah, and that's when it's important really to go to the ER, and we encourage people, especially with those red flag signs. Now, the flip side is it always necessary to go to the ER when they see this type of trauma?
So it's a tough thing because you want the best for your child, and obviously you want to take take them to the quickest place they'll be seen, which is the emergency room. A lot of times when you go to the emergency room, they'll do a CAT scan to rule out any kind of bleeding or major structural issue. But then there's not much else that an ER can really do for you. So typically I advise a patient or their family to come in within a couple days to a clinic to see a concussion specialist. And that's typically when you'll catch the most symptoms and you'll have the best chance of diagnosing it. It's in those first few days.
Yeah, so that CAT scan issue is something that's gotten a little bit more publicity. It's not always necessary. It's a lot of radiation, correct?
Yes.
And parents and ERs now are not doing it as much just because the education's been out there.
Exactly.
Is that correct?
Exactly, yes.
Yeah.
So typically you should be getting a CAT scan if you have one of the red flags, but a CAT scan is not usually necessary, and it's hard because you want to get that scan, you want that assurance that, oh, they're okay. But a lot of times, 99% of the time, it's going to be normal in a standard concussion. Okay. So it's really, we're trying to steer ERs away from doing it unless they find something that's concerning.
The other thing that's changed over the years is the idea of letting the child sleep through the night, like encourage sleep. Used to be you'd have to wake them up every hour, don't let them sleep, right? So that's obviously changed.
Yeah.
So what are we doing now? What are we advising parents to do?
So typically that concern came from something called an epidural hematoma. That's one specific kind of bleed that can cause catastrophic injury. Those are usually from very high impact collisions, such as like a skiing crash or a motor vehicle accident. And so that will present itself within the first few hours after hitting your head, and that will usually present as fainting or loss of consciousness. So that's why people were told initially you need to stay awake, because if you can't tell if someone's fainted if they're asleep.
That's right. Yeah.
So typically I'll advise you can stay awake for a few hours. If you don't have any red flags, then it's okay to sleep through the night.
Yeah, and we want to encourage the rest because that helps heal the brain, correct?
Correct,
Yeah.
yes.
In terms of the actual diagnosis of concussion, this is another area that we often have debate about. To me, there seems to be a lot of energy into trying to find things to make a diagnosis. It seems pretty simple. Your head gets shaken pretty hard, you have symptoms. It's a concussion, right?
Yeah.
If there's some trauma involved. So we spend a lot of money on measuring force to the brain and looking for biomarkers, and which we'll talk about. But it seems pretty simple. And let's work on what can we do to prevent it, number one, and what do we do afterwards, right? To kind of speed things up. So that's what I want to talk about is what's the initial treatment approach, and what is the typical length of time to recover from these type of injuries?
So the initial approach is identifying when someone may be concussed. So if you have any of the symptoms that I mentioned earlier, and you're playing in a game, you should definitely come out. You should tell your teammates to come out. And the first step is getting diagnosed. Once you're diagnosed, then you should rest for a certain period of time. The brain does need to heal after concussion, but there is a certain amount of time that you should rest for before you start to reintroduce activity. The old plan was something called cocoon therapy, where you were supposed to not do anything until you were completely symptom-free. And we found over time that actually caused more trouble than it was worth, because if you take someone out of their lifestyle and their activities, they start to have other issues like trouble falling asleep, which caused people to have worse concentration during the day, and then more headaches, and then you never got symptom-free because you weren't doing the things that you normally did in your day-to-day life. Yep. So now we typically say rest for a few days and then start to reintroduce your normal activities. And then as far as medication for the acute period, which is that first week, basically I recommend Aleve because it lasts 12 hours. You can take it twice a day and you're pretty much covered. Now it's not going to 100% take away your headache most of the time, but at least make it tolerable. And then the actual concussion itself, based on animal and human studies that we've done so far, shows that it lasts about 7 to 10 days, that metabolic change that occurs. So usually most concussions will resolve within 1 to 2 weeks, but obviously it varies from person to person.
Yeah, and I think it's really important for the audience to understand that this is a a biomechanical process that's happening in the brain. It's pathophysiology, we like to use the term. And it's happening over several hours, and then it gets extended. So as that process happens, there can be variations in the symptoms, correct?
Absolutely.
So you want to be protective during that time, and it's really important. You mentioned about coming out of play if you're in a game. That's basically a law now. Every state has that. Mm-hmm. So if there's a sign of a head injury, you're required by law, the coach is required to take you out of the game, mm-hmm. and to wait to return. You can't return the same day. We know that. But you have to be evaluated before you can go back in, and that's really critical. And that saved a lot of problems that develop from multiple head injuries, which we'll talk about later mm-hmm. on. In terms of the initial, this is another big question we get: the school modifications when somebody's going back to school, like after that first week. Mm-hmm. Is there some things that are recommended to help them assimilate? So
I will frequently give my patients a letter for academic accommodations if I feel that it's time for them to try to go back, but they're still having symptoms. So I'll allow them to potentially use sunglasses or earplugs if they really need it, extended time on tests and assignments, allowing breaks as needed. And schools are often willing to work with the students with this if it's obviously comes from a doctor.
Yep. And
that just sometimes going back, even if you have some symptoms, is better for you than staying out for a long period of time. You fall behind in your schoolwork, just being around your friends can sometimes make you feel better, and we find that it'd be helpful even if you're having some symptoms to go back. Yeah, even a few years ago when we were doing this cocooning, it was causing a lot of social changes and changes with the relationships that they were having because they weren't involved in school activities anymore, and they were isolated. The other thing I wanted to talk about briefly was the diagnosis, and this comes up quite a bit. Are we still grading concussions? So we've kind of moved away from grading. So it's not like a mild, moderate, severe concussion anymore, grade 1, grade 2, grade 3. I'll use a scale of probability. That's what I was taught, which is possible, probable, and definite. Okay. And that's just based on the kind of symptoms you had. And that doesn't necessarily mean that one's worse than the other. It's just a matter of how certain are we, and in most cases we'll treat it as a concussion, even if it is a possible concussion. Yeah, I think some of the old-time physicians might still be using some of the grading system. Yeah. But we know the research now, it's not so critical to, again, the diagnosis is made, and then, what do you do afterwards? And really based on the severity of the signs and symptoms, we'll make that difference. What about the importance of some pre-existing conditions or repeated concussions, or if they've had some learning disabilities? Is that a factor? Absolutely, it's a factor. And that's where post-concussion syndrome starts to come into play. So briefly, I'll mention post-concussion syndrome is when the symptoms that started at the point of concussion persist for weeks to months afterwards. And there's a lot of contributing factors. So some of the things that contribute are what you mentioned. So any kind of pre-existing condition or neurologic conditions such as migraines, anxiety, depression, even ADHD and PTSD can not only make it worse, but they'll kind of persist longer after concussion because your brain has already developed kind of compensatory mechanisms to kind of deal with those things on their own, and then when you remove that with a concussion, everything kind of gets dialed up to 11 for a while. Yeah, okay. So when we come back, we're going to talk about in more detail the concept of post-concussion syndrome and how it impacts your recovery from a head injury.
People think I'm trash, but they're wrong. Today I'm just an aluminum can, but one day I could be a stadium.
Welcome back to You and Your Health. I'm your host, Dr. David Bertone. Our guest today is Dr. Sandro Corti. Dr. Corti is a board-certified neurologist and fellowship trained in sports neurology, and we're talking about the concept of concussion and sports concussion. And we left off with the concept of post-concussion syndrome. So this is when the symptoms last beyond that typical 7 to 10 days, correct?
Yes.
And so what basically happens at that point? Is it, the symptoms are lingering and then they start going for evaluations, or the parents start getting concerned, or what's the typical progress along the symptom chain there?
So normally the concussion itself, the metabolic changes will reverse themselves over 7 to 10 days. And the concussion symptoms will normally resolve within a few weeks, but if they continue, you may have some things that are caused by the concussion or left over from the concussion, but there's also other factors at play at that point that can very much contribute to the reason why symptoms are ongoing.
Okay.
And there's a whole bunch of different things. One of the main things I'll see is neck strains. So a lot of times concussions and neck strains will occur at the same time. And if the neck strain is not being properly diagnosed and treated, then those kind of headaches can just keep going on and on. Other factors include the sleep changes. If they never got corrected early on, they can kind of set in and start to play into other aspects of your symptoms like cognition and headaches. And then any kind of anxiety and depression that's developed or was pre-existing and is now worse can also play into your other symptoms. So they all kind of make each other worse, and it becomes this big ball that's worse than the sum of its parts. And that's what post-concussion syndrome is. For a lot of times you'll hear post-concussion syndrome being described as just the symptoms after an acute concussion, but it's an entirely separate condition, and it needs to be treated differently. As like the concussion you rest, but the post-concussion syndrome you treat.
Yeah, so that's a good point. And I think the other symptom you might have missed was the dizziness. That's very common, right?
Yes, absolutely.
And so when you say the treatment of post-concussion syndrome, I've been involved in this for over 10 years now, and when I get the kids now, we want to move them. We want to treat their symptoms when we can. The headaches, we treat their neck. Sometimes there are cervical or neck problems that need to be addressed. But we want to get them moving with some physical exertion, but we want to monitor their symptoms during it to see if it changes anything. And then we work on some of the other residual problems, things like the balance and dizziness issues that can be present. And then often work with other practitioners in terms of vision changes, cognitive changes. We get neuropsychologists involved and psychologists.
Yes.
Are there other approaches or other things that are really important during this time period?
So kind of just to go back to what you're saying, the people that actually help me the most get these patients better are physical therapists. They do the dirty work, the leg work, and getting them better, whether it's the vestibular therapy, the vision therapy, the cervical therapy. All those things kind of need to be addressed at the same time. And so that's usually where I'll send people first for their post-concussion syndrome.
Okay. And then if they have some other problems, cognitive changes,
Yes.
where might they go at that point for some of that treatment?
So the first thing I'll tell a patient is, until we get your headaches and sleep under control, I'm not super worried about your concentration or memory trouble. Because if you're not sleeping well, you're not going to be able to focus. Like if I took any person, concussion or not, and said you can only get 3 hours of sleep for the next month, they're going to have trouble at work, they're going to have trouble at school. So once we get those factors under control and there's still trouble with memory or concentration, then I'll send someone to a neuropsychologist. Now it's not necessarily a bad idea to go early and kind of establish yourself with neuropsychology as well, but it is a more time intensive process. So I want to make sure that we're dedicating those resources to someone who doesn't need the easy fix of headaches and sleep.
What about some medications at this point? If their symptoms are lingering longer, what are some of the things you might consider for some of those symptoms?
So once we're out of that first few weeks, then we start to bring in other medications. And there's no one perfect medication. It starts to fall under the category of like migraine medications. So there's certain antidepressants or anti-seizure meds that can be tried. There's occasionally blood pressure meds, and it really depends on what symptoms you have. And whenever someone comes in with post-concussion syndrome, I kind of go over all those options and the pros and cons. Certain ones can actually help multiple things at the same time, and usually we'll go with those.
Okay, good. Now, so they go through the rehabilitation process, and then there's something that became very prevalent based on literature, and that's return to play decision making. So let's talk a little bit about the return to play process. So now they're feeling better, their symptoms are nearly resolved, and they want to get back to the sport they love. They want to enjoy that. What is that process like now?
So as far as with competitive sports, there's a return to play process that's advised that occurs over about 4 to 5 days typically. And it's called a graduated exertion process, meaning every day you push yourself a little bit more and start adding different aspects of physical activity until you get to the point where you're basically practicing normally without any symptoms. So you'll typically start with simple cardiovascular work, such as a stationary bike, and kind of see how you feel. Now, sometimes you can get symptoms while that's happening, such as like headache or dizziness or balance, and you follow up with a specialist when you get those symptoms and kind of decide whether you should continue or kind of repeat the step. And once you've finished a step, you can progress the next day to the next one, which will go into things like jogging and then agility training and then sport-specific drills, and then finally a normal practice. And if you pass every step, then you'll see the specialist again before you're finally cleared.
Yeah, we do this in our practice, so especially in the youth sports, because they don't have the trainers back at school.
Yes, unfortunately.
Right? So the high school kids is a little different. So we work on them with the post-concussion syndrome. We get them feeling better, we get their symptoms resolved, and then we'll send a report to the trainer and say, hey, they've been cleared by their physician to start return to play, and now they're supervised. But what do the youth sports do? You know,
Exactly.
Yeah, they're not getting that, and that's where we come in. So we do that in the practice. So we'll put them through the various stages and get them moving their head in preparation for sports and see if it causes any symptoms. I think it's really important, and that's really been the crucial thing in the research to prevent the catastrophic problems that can occur.
Yes.
So let's talk about some of the bad things that can happen. The major bad thing is the second impact syndrome. Can you talk about what that is and what can happen when that occurs?
So second impact syndrome is a rare but catastrophic condition where you got a hit that caused a concussion, and then while the concussion is going on, you got a second concussive hit that causes swelling inside the brain. And now, when that swelling occurs, there's a high mortality rate. Frequently, patients die when they get this. It's not something that's happening all the time, but it's a real risk. It exists, and it's one of the main reasons why you should come out if you suspect a concussion.
Yeah, and it's that point of returning too soon and knowing when it's too soon, right? So we know the same day return multiple head injuries could be catastrophic. But if you don't know that there's still a problem and you go back maybe in a couple weeks, but it's really maybe too soon, that could be dangerous as well, right? So making that decision is really important. That's where the specialist comes in and make that decision.
Absolutely. Part of it's also if you're still having balance issues or vision issues and you go out there on the field, you're not necessarily reacting as quickly or sharply as you normally would in order to prevent yourself from getting a hit that may cause another concussion.
Yeah. And one of the things that we've been promoting for many years is the concept of comprehensive baseline concussion testing. And I know there's some research and there's some different types of programs, and some of the high schools will do basic neurocognitive computer testing. But it's not enough. There's a lot of systems involved here. And what we do in our practice is we do a baseline of their balance, computerized balance. We look at their eye processing speed and their cognitive function, and we get a healthy baseline. So then we know after the injury what their objective data looks like, and then we can tell the specialist, hey, there's still some problems compared to initially what was happening. And it's really been effective, and we do it for places like Red Bank Catholic now, their high school athletes, and some youth groups in the area, which is really, really important. But some of the high schools are not getting that, and I'm really concerned about it, that what they're getting is really just a a little snippet of the picture, and it could be a little dangerous. Let's talk about the concept of baseline testing and why that could be so important here.
So with baseline testing, it gives us a much better ability to accurately diagnose someone's concussion and also their recovery. So some patients have a little bit better balance than others, and we kind of want to know where they stand initially, but then we can also use that to compare when they do have a concussion to see where they're at when they've normalized. And so having that baseline information is very helpful for us in trying to get people back on the field and ultimately safely back to their normal lives. Yeah,
we kind of think about it. We tell parents kind of like an insurance policy, and we try to get them to do it, to have this data. But quite often we'll get the call afterwards. Hey, we didn't do it. What can we do now? My kid had a concussion, and so we'll educate them about what they can do and where to go and things like that. So I think it's really important to have that information when you can. Quickly, there's a concept, in the chronic stage, especially the professional football players and such. There's a concept called CTE. Can you just talk about what that is briefly?
Sure. So CTE, chronic traumatic encephalopathy, is itself first a collection of proteins in the brain. That was how it was discovered. But it's also associated with a particular syndrome, a combination of symptoms, which everyone's kind of heard about now, which is the cognitive changes, the behavioral changes, the occasional suicidality that comes into play, Parkinson's. And so there's a lot of research left to be done. And it's not something like post-concussion syndrome where you've had a hit and you've had symptoms going on for a long time. CTE, and particularly the syndrome of CTE, comes on decades later. So you've been fine for a long time, and then all of a sudden these neurologic symptoms start to come on, and there's no other real obvious cause other than you had a long playing career of contact sports.
Yeah, and high velocity and high impact.
Yes.
Not necessarily from playing Pop Warner football and then never again having any head injury. I don't think there's been any research on that.
Yeah, there hasn't been much research, but it's also, we're not seeing that group of patients developing CTE.
Yeah.
It has to be, first off, the major misconception is that it has something to do with the concussions themselves. It's not about the concussions. It's about the hits, the actual hundreds and thousands of hits you've had over many years or decades.
Yeah.
So I tell patients, there's that old 3 concussion rule that's still hanging around that's not based on anything.
Yeah.
Don't worry about any number of concussions. It's about how long have you played, what kind of sport have you played. So typically, if someone's played collegiate contact sports or higher, then we'll have that kind of discussion. But we're not seeing high school football players going on to develop CTE.
Great. Briefly, what's the future of concussion diagnosis and management? What do you see down the road? What's going to happen?
For concussions, post-concussion, or CTE?
Yeah, I would say just the diagnosis of concussion, say.
Sure. So for concussion, there are some biomarkers that we're starting to look into. Last year, there was that blood test that came out that got some press called the concussion test. It doesn't actually test for concussion. It was kind of mischaracterized. It'll tell you if there's potentially blood on the CAT scan if you do it. So if it's negative, you might have a concussion. That's all that test says. But we're still looking at different biomarkers. There's a couple that show some promise, but we're still working on it. I think probably within the next 10 to 15 years, we might have something that could be used at the professional level.
Great. Well, Dr. Corti, thank you for joining us today.
Yeah, no problem. My pleasure.
And thank you again for joining us on You and Your Health. I'm your host, Dr. David Bertone. Until next time, we'll see you then.